Thank you so much. Good afternoon, everyone. And I'd like to officially turn the meeting to our chairperson, Dr. Brophy.
Okay, so I'd like to call the meeting of the Board of City of Brockton for June 3rd, 2020 to order. The first item on the agenda is the minutes from the May board meeting. If members of the board had a chance to review, and if so, a motion to approve or any edits needed.
Motion to approve.
Seconded.
Okay, hearing that there are no edits, all in favor?
Aye.
Next item on the agenda is a special inquiry from a Mr. Goncalves, soliciting the board, asking questions about tobacco permitting and licensing for food trucks. Is Mr. Goncalves on the line?
Yes. Let me bring him in at the moment. Okay. Hi, Mr. Goncalves, how are you? Can you hear me? Do you want to?
Yes, I can hear you.
Okay, okay, all right. So we are in full board. We have Mr. Fisk, Dr.
Yes.
Mary Brophy, and Dr. Craig Andrade. I think,
Lovely.
I don't know how many of them you know, but I have, as you asked me, so I bring you so that you could present your inquiry to the board. I know based on the letter, the conversation with you and
Yes.
the letter that you have forwarded to my attention, there are
Yes.
two issues I think that you looking to get information on. It's licensing, tobacco licensing, and also food trucks in the city of Brockton. So Dr. Brophy, those are the two issues that are highlighted on the inquiry from Mr. Goncalves.
Yeah, so if you'd like to present his questions to the board, please do so, sir.
Lovely. Okay. First off, can everyone hear me? Am I coming through loud and clear?
I can hear you.
Okay, lovely. Okay, so first and foremost, good afternoon to the board, and thank you so much for placing me on the agenda. I'm very grateful for you dedicating a little bit of time just to hear me speak in relation to these issues. So I've been a resident of Brockton now for almost 17 years. I basically spent the entire time I was a teenager and most of my adulthood now. I'm 30 years old in the city of Brockton. I originally moved to the city of Brockton because my family is an entrepreneurial family. They opened up a restaurant on the east side of Brockton, directly across from East Middle School. And we've been operating that business for about 18 years now in the city. And we're very proud of the city. We're very grateful residents to the opportunities that Brockton has provided us. And we're day in and day out servicing the community. I myself, went to public schools throughout the entirety of my life. Graduated from high school, went to the University of Massachusetts in Amherst, finished my studies, worked in my field, did all of that. And then eventually I chose to begin kind of taking over the family business and seeing if we couldn't grow it. And a lot of that was inspired by the success that I had seen other members of the community have in taking similar routes and attempting to grow the seeds that their families had planted here in Brockton. So I just wanted to give all of that context beforehand so that you would understand more or less the point of view that I'm coming from as a citizen of Brockton, as somebody who's been residing here for almost 2 decades now, and somebody who's truly invested in the betterment of the city as a whole. So on a couple of different occasions, I've reached out to the Board of Health and spoken to individuals who work there, both about hookah and about food trucks. Now, in relation to hookah, the information that was conveyed to me is that hookah is illegal in the city of Brockton. I was told that there are a limited number of tobacco licenses in the city, and those limited number of tobacco licenses, there's no process that exists, or there's been a restriction made on issuing out any new licenses. And then, per my knowledge, all of the tobacco licenses that are currently in effect and being used are for establishments that sell tobacco products to be consumed off of their premises. So whether that's a smoke shop or whether that's a local corner store that sells cigarettes or whatever the case may be. Now, in the case of alcohol, I know that the licenses work a little bit differently in the city. There's alcohol licenses for on-premise consumption, such as is the case for our restaurant. And there's alcohol licenses for off-premise consumption, such as the case of, liquor stores and the like, supermarkets and such. Whereas I believe that distinction does not exist with tobacco licenses. So, I'll kind of try to separate out each issue. So in relation to the tobacco licenses, I took the time to look over the tobacco regulations per the instructions of one of the women whom I spoke to at the Board of Health. I didn't see anything in the tobacco regulations that outwardly prohibited on-site consumption of tobacco products. I didn't see anything in those tobacco regulations that outwardly prohibited the tobacco licenses. So I wanted to speak to the board to see what their viewpoint was on this. If it is indeed prohibited and that information is correct, why that is the case, if there is any existing precedent or any pressing reasons as to why that is the case, when I know that in other communities, even in communities that neighbor us, it is allowed, it is something that is practiced. And in fact, many residents of the city choose to frequent establishments in neighboring cities and neighboring towns in order to be able to consume products such as hookah on site. So that was really the main question that I had in relation to that for the board, if you would be so kind as to kind of elaborate on it.
Well, I'll bring up one thing. This is George Fisk. Did you plan on selling it there at the at Luanda? The products?
So not necessarily. So it's something that I am considering if it is a possibility. However, even if it doesn't happen here at Luanda, because we have a business that's really established around food, and it's been the case for many, many years. I know there are many other people who are interested in having a space similar to a hookah lounge and things of that nature. And so even if it doesn't occur here, it may happen at some other venue, as long as it is permissible in the city.
Well, the one thing I was thinking that, every once in a while I like to have a cigar. And I know there's places in the city that I can go, whether I purchase it there or not, I'm still allowed to on a porch or in an outdoor setting, which I know you're sitting there in your outdoor setting, that, if somebody brought something in, it's a cigarette product that, other places we could, allow to bring in and sit in an outdoor setting for us and have that type of product if we bring it in ourselves. So I didn't know if you're trying to sell it or if you're just providing a space that people can come and have it if they bring the product in and have it there at your establishment outside, of course, with a cocktail or something like that. Is that what you're looking for?
Yeah, I think for the uses of our particular establishment, that's something that obviously I would explore further depending on, the results of this meeting or any subsequent ones. But I think the bigger question is really on a citywide level, what the board's view is on it and what can be done to make something like this feasible. Because it's one thing for me to come in and just champion our business and what we're attempting to do or not attempting to do here at Luanda. It's a different situation to kind of look at the city as a whole, because there are other entrepreneurs. There are other folks in the restaurant, entertainment, hospitality space that have also made inquiries like this, that are also interested in things like this. So as opposed to having each one of them send letters and each one of them request to meet to the board, and the board having to repeat the same information, I figured it'd be best to kind of just get all of that in one and then be able to kind of advance from there.
Do you mind if I call you Jason?
That's perfect. That's perfectly fine. How are you, Dr. Andrade?
You can call me Craig.
Okay, thank you.
So, first, in terms of the tobacco licenses, we several years ago created a change in the ordinance that restricted the amount of retail licenses for tobacco products. We did that because we recognize that in general, it's important to acknowledge the mission of the Board of Health is to try to create and maintain environments for the community that allow people to be as healthy as possible. And the concern was that the number of retail outlets compared to other cities was growing beyond what we think is a balanced number. And so we were able to, through regulation, cap the number of retail licenses, and we have maintained that cap for those that are existing and not adding new ones. And that is to make sure that we don't continue to expose the general population to a greater number than any other community might have in their own environment. Dr. Montessor, can you speak to any specific regulations that we have for hookah products?
Excuse me. I can do a little bit more research on that, but one thing I do know is that not only that there are municipal restrictions, but there are state restrictions as well. Presently, there is a strong state regulations going on around the Massachusetts, where the state demands that there are 2 letters to be displayed on the premise where they sell those products. One is from the manufacturer, and another one is, I believe, from the state local board to allow if the place is allowed to function or to dispense these products. So I can further look into the issue, but I know that it's not an issue that is controlled simply by the municipal government.
Yes,
Dr. Brophy, can you say anything about, I'm sorry to interrupt you, Jason. Dr. Brophy, can you say anything about what you know about the hookah products, or do you want to add anything to what I said about the tobacco licenses?
No, thank you. I actually had a little difficulty unmuting there, so thank you. Yeah, as Craig presented, we have worked within the city, based on our population, many more smoking or tobacco establishments than really compared to other cities. And also, at the time where we had changed the ordinances regarding the tobacco licenses, there were also issues about other types of tobacco products that were very high use, flavored tobacco products, et cetera. And some of the processing and labeling and marketing of them, which were targeting younger residents within the city, with some cases of nicotine overdoses in young children because of things that look more like candy than tobacco products. So it was a time that we had to go back, and also vaping was becoming an issue at the time as well. So as Dr. Andre pointed out, we limited the number of licenses within the city and have not allowed for expansion of tobacco products. And it really is being driven by our overall mission, which is to increase the health of the residents of the city of Brockton. There are tobacco products available. As far as the hookah, at the time we weren't increasing establishments for smoking, but again, there are other overriding regulations from the state that, as Dr. Montessor has pointed out, and at the time we're limiting establishments where any type of smoking, vaping were taking place within the city. So.
May I speak?
Yes, please.
Okay, lovely. So I took the liberty of jumping ahead and reviewing the Massachusetts general laws on tobacco usage, specifically within establishments and things of that nature. I know that within Massachusetts, smoking inside of restaurants and certain other commercial establishments is definitively prohibited unless it's the case that it's a social club or things of that nature where it's accessible only to members only. It's not accessible to the general public at will. However, there was some gray area specifically when it came to outdoor usage. Now, if we're talking about, for example, for our specific establishment, we do have an outdoor area that I'm actually sitting inside of at the moment, and I can just pan the camera a little bit for you to kind of see. And so what I assumed is, again, for our establishment, if it gets to that point, it would become something where most likely it would be permissible outdoors, but not necessarily indoors. But in that same breath, there are establishments within Massachusetts. Again, there's one right next door in West Bridgewater where it is permitted indoor, and the establishment markets and bills itself as a hookah lounge, and there is indoor smoking allowed. And that's one of the categories that, according to Mass General Laws, Part 4, Title 1, Chapter 270, Section 22, is allowed for those types of establishments. So in the case of Brockton, although, and I definitely understand the board's viewpoint as far as, you know, the health of the residents, ensuring that we're not overpopulated with tobacco establishments or overpopulated with liquor establishments, especially compared to other cities of similar size and similar demographics. But in the case of Brockton, there are no on-premises tobacco licenses. So even though the retail tobacco licenses that exist may have been more than the number in other cities with relatively the same populations, none of the options exist on an entertainment level or on a personal enjoyment level of on-premises. So what I hope that the board would be able to do is, I don't know if it would be possible to create a new category of those types of licenses. I know that also in the case of alcohol, for the city of Brockton, because there are two categories, on premises and off premises, the on premises licenses are open and available because Brockton doesn't have that many establishments relative to its population. So somebody can go, they can rent a commercial space right now, they can choose to open up a restaurant or a bar or whatever the case may be, and they're able to acquire a license simply by going through the application process and getting licensed through the local board and the state. Whereas when it comes to off-premises consumption, such as in the case of liquor stores and the like, and supermarkets and so on and so forth, that sell liquor for people to consume in their homes or in their residences or wherever the case may be, as long as it's not on that site, those licenses are closed because, again, Brockton has too many of them relative to the population. So is that something that the board could consider, where they maintain the ordinance for the existing tobacco licenses, but they create a new category where those are open and available to be applied for by those who are interested, by those who have the resources to ensure that, you know, patrons are going to be consuming responsibly, and, you know, the establishments are going to meet all local codes and regulations? Is that something that is feasible?
To be clear, Jason, are you asking that there's some regulation or some allowance be made for customers to bring their own products to your establishment and smoke them outside in the space that you describe? Is that what you're considering? Or are you saying you want to be able to sell them and be able to use them outside?
So I think our particular establishment at the moment is not really my focus. It's more the city. So what I would like to see is a situation where the board says, okay, our existing tobacco regulations are going to stay as is. We're going to create a new category of tobacco licenses for on-premises consumption. If somebody wants to open up an establishment that folks are able to come to and purchase tobacco products at that establishment for use there, not for use, anywhere else, that is permitted, as so long as they apply for the correct licenses, pay the taxes, follow the rules, and all of those things. Similarly to what they have in East Bridgewater, similarly to what they have in Boston, similarly to what they already have existing in Providence and other areas, because the residents of the city are already leaving the city to go to these other places to have this usage or to be able to enjoy themselves in this way. They only don't do it in Brockton because it doesn't exist.
Well, first, I'd like to understand whether there is a regulation on our books that speak to hookah, for example. That is something I don't know, and so we need to, because if there already is, we have a different conversation here.
Okay. In searching the tobacco regulations, I didn't see anything outwardly that prohibited hookah, but because it does use tobacco in the hookah, I know that it's going to fall under the regulation prohibiting any additional tobacco licenses. So that's why.
Right, and on its face, the idea that we would have a different license for something to happen on premises, in a sense, where we're doing a subset of what we have tried not to do, is to add new licenses where people could buy tobacco regardless of where they smoke it, whether they smoke it on the premises or whether they smoke it somewhere else in their home or in another part of wherever they go. The spirit of the regulation is that we don't want to add more retail outlets, and so this would be a different version of a retail outlet that we would be adding. And as we mentioned, the goal was to reduce the exposure of our community members to an over population of outlets that made them more at risk than our comparative cities like New Bedford and others that are same size, same demographic, same number of outlets. We already have more than many, and we didn't want to add any more. Yeah. So we have some information to gather, and on its face, what I think I'm hearing you ask is that ultimately would, in a sense, do the opposite of what our regulation that we recently put forth is doing.
Right. Yeah, and I agree. That's exactly, the spirit of it is to not increase the retail sale of tobacco products within the city. And there are clubs within the city that had on-premises smoking and have tobacco licenses, and they continue to be allowed to the private clubs, et cetera, that had tobacco licenses prior, still allowed to have the smoking on site. They were clearly had that existed and fell within what's allowed in the state laws for public use of tobacco products.
So I still think what we're getting down to is tobacco license that we're not issuing anymore. But this with the hookah, I think, is a little bit different. We're not talking about a retail store. We're talking about, a certain part outside of a restaurant that you could bring your own, tobacco into. And now when we see nowadays with, I'm not saying the tobacco and pot is the same thing, but we're getting pot stores all over on every corner lately here in Brockton. And this gentleman's very well spoken. He and his family run a very good restaurant and everything. And he's just asking it to have it outside there, which is a way for the public. And I also noticed that it had to be 21 too. I remember seeing something 21. So I think he's, very well spoken, knows his thing, very well run restaurant. And there are other, places that are a restaurant that people are able to buy or bring your own tobacco in and sit on the back porch and have a cigar or whatever, or a cigarette, even though it wasn't purchased to that thing. So I don't think he's talking about anything different than what's done at some other places too. And, and he's nice enough to come to the board and be very well spoken and explain his situation.
Thank you.
I appreciate that, George. I just wasn't clear, and it's still, maybe I misunderstood. If you're thinking that someone would bring their own hookah apparatus and their own tobacco, that's different than you selling, because I heard you say a different version of a license where you could sell products for use on the premises. Did I mishear?
So this, in the case of our establishment, actually, if you wouldn't mind, could we switch gears for 2 seconds and just let's speak about like individually our establishment. Would it be permissible, because there's a lot of gray area when you review the tobacco regulations, both on the local level and at the state level, would it be permissible if a customer came and they wished to bring their own hookah and we allowed it to sit in our outdoor area and to smoke their hookah? No financial exchange occurring between us as an establishment, as the person. I believe that would be, that is permissible and that is okay as of today, correct?
As far as I understand, every establishment, especially outside, because again, the state has inside regulations.
Yes.
But outside,
Yes,
you as a business owner can decide if that is possible. I mean, and there are certain business owners that do make a section for smokers to make sure those other restaurant customers that don't want smoke have a space away from that. So at least my understanding, and I welcome everybody else's perspective, that you're not exchanging money, you're not selling anything. People come with their hookah pipe and do something in a space that you've made available to them. My understanding is that's allowable.
Okay, lovely.
And Mary, Dr. Brophy, is that your understanding?
Yeah, many businesses and places have places for their people to go outside and smoke, but it has to be a very separate area from if it is outdoors. You're right. There's vagueness in the laws about this. I mean, we certainly can run it by our legal counsel here, but my understanding is if it's outside and it's a designated smoking area, you're not selling the products. It's a person bringing their own product. You've designated an area that a smoker can smoke. So.
Okay, so I think that in and of itself is a non-issue. We're kind of all in agreement and understanding in relation to that. Now, sit on a larger level in relation to the city, and again, I completely hear and understand what's being said as far as the spirit of passing this ordinance and restricting these licenses was to try to curb the amount of usage or the amount of exposure that the residents of Brockton are having to tobacco products in comparison to other cities, in comparison to other towns, which are similar in size and scope and population to ours. I guess the counterpoint or the challenge that I'm making is, but is it truly actually curbing the usage of the residents, or is it just a situation where the residents continue to use it, but they just choose to use it elsewhere?
Well, again, we can only control our space. We only control Brockton. And as Brockton residents and put in charge and our responsibility as a Board of Health have said, we're within our circle of control, we're going to say these are the limits that we're setting forth to minimize the harm that potentially could happen from a health perspective around tobacco products. We can't control what someone does across the borders in Easton or New Bedford or Randolph or Stoughton. Those are their cities and towns, and they control that. We can't control that, but we can say we're not going to make it easier for people to do things that can have a negative effect.
And if I may jump in also, I know that in Boston, which is a totally different city, very liberal, but they do have control also on the number of places that can open to sell liquor and tobacco as well. So we can entertain the idea and talk about it a little bit longer, but also we have a long agenda for the evening. I don't know if we will have the time to carry a very engaged discussion for the rest of the evening, but at least I just wanted to make that make a point there.
And my goal in coming here today, I wasn't necessarily expecting that, okay, I would come, I would propose this, and boom, everybody would be in agreement, and then boom, now it's allowed in the city of Brockton. My objective was really kind of just to present these points, present the view as a young Brocktonian, a view that's shared by many of the residents in the city, particularly the younger residents, and to kind of have it be food for thought for the board that maybe we can schedule, a follow-up meeting or at the following month's meeting where you've had some time to kind of research the issue and let it marinate, to just kind of continue that conversation to see if there isn't a healthy compromise that we can arrive to. Because again, it's not without precedent. If we look at, if we look at tobacco's cousin, alcohol, even in the city, we have two categories of licenses because we understand that although it's the same product, its usage is inherently different. And as a result of that, the on-premises is not limited, whereas the off-premises is limited. Whereas tobacco, it's all kind of grouped in one category. And what it's left us with is essentially a void of establishments that could cater to the general public. So at the moment, if you're a Brocktonian and you wish to consume a tobacco product, for example, indoors, you don't have any option unless you belong to a social club or you go to a neighboring city or another community to do so. And so I don't believe there are very comprehensive health statistics on it to be able to say, okay, since the time that the ordinance was passed and the tobacco licenses has been restricted, Brockton tobacco usage by residents has dropped by X, Y, and Z percentage. I don't believe that anything comprehensive out there exists. I could be wrong, but I don't believe so. But what I do know is that many, many, many residents have instead just chosen to take their business elsewhere. So it's been more so to the detriment of Brockton, whether that be in terms of tax dollars, whether that be in terms of attractiveness of the offerings for entertainment. I know that a lot of times things that have to do with the restaurant industry or hospitality or entertainment or nightlife can have a negative reputation, especially in the city. However, if we look at any thriving, bustling, booming metropolitan area, it has a plethora of options for its residents because we recognize that being able to enjoy oneself, being able to have leisure, being able to, escape from the drudgery of the day-to-day is part of life as well. It's part of your mental health. And it's very disheartening as both a resident and an entrepreneur in Brockton to have regulations on the books or a lack of regulations in certain cases, which kind of prevent more attractive options from existing in the city and always having to go outside of the city in order to be able to acquire that. But
Jason,
like
let me respond to this, and we're going to move on to the rest of our agenda. So
No worries.
in brief, I appreciate your argument. The fact is that the state does regularly survey to recognize how tobacco use is across the state, and we know for year after year and decade after decade, southeastern Massachusetts has a higher tobacco usage than the rest of the state. We smoke more in this area of the state than other parts of the state. And Brockton, because it has a higher number of retailers than others, has a higher rate of smoking compared to other cities that have lower retail outlets. That's consistent data. And ultimately, all of this is driven behind the fact that decades of data show that tobacco, in comparison to other substances, it is one of the #1 killers of individuals in the world, bar none. There's no question about that. So,
no, I understand.
I hear you about the business. I hear you about individual choice. There are plenty of places for people to go in Brockton to get cigarettes and cigars and those kinds of things and use them where they are. And the idea that we would add more opportunity to do that through hookah, or whether we're inside or outside, is unlikely. But as a resident, you're always welcome to propose a change in ordinance and bring that to the board to entertain. We also have to do our own due diligence to understand whether there is any ordinance on the books that already prohibits hookah. We can clarify that, and perhaps Dr. Maceras can get back to you if we do have information that we weren't able to share today, so that you don't run around trying to kind of add more information to that. So,
No worries.
go ahead, George.
Greg, I have one question just to satisfy what he came for, the hookah being in his lounge. What if somebody came in tonight with their own product, with a hookah, which would be no different than me having a cigar down?
Yeah, no, we established that. They can do that if they feel like it. Yes,
so they could bring in their own product in his place, and he'd be perfectly legal as long as he's got an isolated area that's not going to be bothering people in his place.
Exactly.
So that's
That
something
is
you
correct.
can do now, Hoyer. You could have somebody come in with their own product.
No, lovely. I understand that. I figured I'd
So
address
that's
the
something
larger.
on a trial basis. Maybe we can talk, the doctors and I, we can talk and bring it a little bit further, because things have changed. I mean, like I said, with the pot, you have these pot centers on every corner now, and things have changed since a little bit since we decided with the tobacco licenses and everything. So,
Exactly.
but I guess if somebody came in tonight with a hookah with their product, I guess they'd be perfectly welcome.
Okay. And then, so that we just don't stay completely focused on hookah the entire time, I definitely understood what Craig had said, and I will definitely look further into that, whether that be the data for Southeastern Massachusetts and Brockton specifically, and the perspective of making a proposal to change the ordinance. In relation to food trucks, which is another just element that I was informed is also not permitted in the city of Brockton. And I've had a conversation with the gentleman over at the Board of Health who, unfortunately, I don't recollect his name, but he had said something that they've been prohibited as long as he's been there. And if I recollect correctly, he said something that's like 30 to 40 or even 50 years that he's been at the Board of Health. And when I kind of inquired a little bit further as to why, he didn't really provide many justifications that made sense to me, at least. So could any of the members of the Board of Health kind of speak to that, why it's not permitted to have food trucks in the city of Brockton?
I think we have to do some research on that, because a lot has changed, I think, since that. That's not something I'm aware of. And so having an opportunity to understand that, I mean, that's a different discussion, a very different discussion that has all kinds of possibilities compared to what we were just speaking about.
I know there is
there also may be other ordinances, that are needed for, for establishment of this, that the city may need to put in place. So, this is one where I don't think the board, we'd have to go back and look at what the ordinances are in the city and what requirements for establishment of a food trucks and whether city ordinances would have to be changed to allow this. So, given the time, we do need to do some research on this and talk to some of the legal department and get some background on the city history on this in order to more fully understand the situation. So. And
Jason, what I would also encourage you to do is, here's where you could talk to some of Brockton's counselors to consider. This is something you're interested in, a food truck. That's where someone in the city council could bring that to the city council to consider. If there is something on the books that needs to be reevaluated and revisited, that's probably the better place to consider that.
I know there is precedence for it because there was a family, he and his father, that did have a food truck for years, and he's planning on opening up again. So I know there has been a food truck. I think there was a question whether they cook inside the food truck or they just serve sandwiches. I think there's something to do with that, but I know there has been a family for years and years had a food truck here in Brockton. And in fact, I've eaten it off of it.
Gotcha. God bless it. So yes, what I was led to believe is that if it was something like a canteen truck, the ones that serve like cold sandwiches and cold cuts and things of that nature, those are perfectly allowed and permissible. But if it comes to an actual food truck that has, a hood, it has a range, it has a grill, it has a flat top, it has cooking equipment in it, and they're actually preparing the food there, then it's a different category, and that wasn't permitted. And the
Yeah, that would
And-
require coming, because you're preparing food for distribution. That would come if that's allowed in the city. And again, ordinance may need to be changed more by the city council, and this is where we have to go back to look at the legal. But if that city council was to allow that, then the Board of Health would have to approve the food establishment to assure the food safety and health of the individuals, safety of the food and distribution of that food to individuals within the city. So.
And
would need
Jason,
a-
so what you're hearing here is there's where you have an opportunity to make positive change from an entrepreneurial and service provision state. So Brockton is right to have food trucks. I love the food trucks that I see in Boston when I'm there all the time. This would be a great thing for the city, and I would encourage you to think, you know, if there may be some counselors that you can connect with that might want to champion that for your consideration and for the consideration of the city.
Understood. It's strange because at the time that I had inquired, they said that it was something that was specifically under the jurisdiction of the Board of Health. So that's why I didn't even think to go to the city council or the city councilors.
That is true, but it is only, we just look at the kind of overall health element. And I would imagine none of us on the board now were on the board if whatever is on the books right now. So this is again, here's a new time. Brockton is ripe for this kind of consideration. It would be reasonable for you to bring this to the council to consider and have maybe one of the councilors take it on as something to champion. It's another way to bring business to the city.
Right, and there may be issues around zoning, where the park, these are the type of regulations where the trucks can be located, et cetera. That the city council would have to be involved in creating those regulations.
So it's not just a Board of Health thing, and there may be multiple other considerations.
Understood. Okay, well, I'll do my due diligence then in relation to the city council in regards to that issue. As far as a follow-up, because I'm aware that this was just an initial conversation and, subsequent ones would need to be had. Is it just a situation where I, once again, send an email to Dr. Eno, request to be added to the following month's agenda, and then revisit the topics at that time? To revisit it, to put it back on the agenda, you need to bring new information about it.
Right.
Understood. So just kind of in summary for both of those issues, the hookah and the food trucks. In relation to the hookah, my understanding is that in the spirit of limiting tobacco usage as a whole in the city, regardless of what's happening in neighboring communities, regardless if residents are going to other cities and towns that are in relatively close proximity in order to consume it, it's the board's viewpoint that they do not wish to have any additional licenses in any capacity, whether that be on premises, off premises. They're just completely, in essence, against issuing of any permission to sell tobacco products, regardless of where, how it's consumed.
Correct.
Okay. And then in relation to food trucks, that is something that the board is willing to consider depending on how the conversations go with the city council or specific city council members. That is something that possibly could be approved for the city of Brockton, correct?
I think there's room for exploration and strong room.
Yep.
Okay.
Great.
Agree.
Okay.
Yes.
Lovely. Okay, so I will do my due diligence and I will see if I can present additional information, and hopefully come July, when it's time for that first meeting, we can revisit these topics and hopefully push it forward.
All
Thank
right.
you for Jason.
Okay.
Thank you.
Thank you.
Lovely.
Good talking with you. Take care.
Thank you. Thank you so much for your time. I appreciate it.
You're welcome. Bye-bye.
Bye-bye.
All right. So let's move on further. And so the next item on the agenda is the COVID vaccination clinics that have been taking place around the city. And I guess there's going to be some changes that the COVID vaccinations, the is going to continue having vaccination clinics. You'll be working with the mayor to set up a weekly clinic. at some time, but that the Brockton Neighborhood Health Clinic will be no longer at the Shaw Center starting June 25th. Is that correct, Dr. Montefiore?
Yes, that is correct, because the demand is not quite there, and so the resources exceed the demand. In other words, the manpower, the National Guard provided by the federal government, I think about over 10 members, and so therefore they don't have that many people coming to the Shaws every day, and so therefore they're going to reduce the manpower. And by that date, the June 25th, the feds will probably redispatch some of the National Guards to some other capacities, and then Brockton neighborhood is going to look into going back into health services, instead of being a response to just COVID.
Exactly. And when you'll be making public announcements as to where and when you would be holding your weekly clinics moving forward. Is that the plan?
Yes, we do this, and in fact, we have a meeting. I have a meeting with the mayor and Bima and Dr. Herman, who is the mayor's medical consultant. We are looking at least to the last Saturday of June, without any alteration, to hold clinic at the Shores, and then from that point, probably we will decide again how to move forward, how to proceed.
Okay, so you'll be having weekly clinics at least until the end of June, and then a decision made on further vaccination clinics at that point.
Correct.
Okay, great. Okay, thank you. Okay, and next item on the agenda is any questions from the board members on that issue?
No.
No, no.
Nope.
Oh, okay, and we're moving forward with the van project?
Yes, we had to do some due diligence to have the van redesigned by the dealership, and probably by tomorrow we will have a full quote, both on the final pricing of the van and the additional work. And then from that point, we will present the quote to procurement and finance, because that's something we need to do before June 30th.
Okay, all right.
Okay.
Any questions from the board?
No.
No,
Okay, great. Next item is the nursing position. So we were able to fill the position.
Yes, the position is filled. When we did the last round of interview, there were only 2 applicants, and only one was already qualified. The other one was to complete her degree sometime the end of this month, and then she would have to proceed for state licensure. So that gave us just one applicant, but that applicant was also in earlier round of interview. We just didn't have the space to really accept more than 2 applicants. So we had no choice but to just, based on the qualification, so we extended the offer to that one applicant that was qualified. And so she's been in as of last Monday.
Okay, great. So now the board is, the nursing positions in the board are fully staffed at this point?
Yes, ma'am.
Okay, wonderful. Any questions?
No.
no.
Okay, and you are currently, Dr. Montefiore, preparing the FY22 budget for the Board of Health that's going to be presented to the City Council?
Yes, on next Tuesday, I will be meeting with the City Council to go over the budget for FY22, and we did not really put any more meat to the budget as we had it on FY21. So basically, we're moving with a bare bone budget in terms of city dollars.
Okay, all right. And the 3 nursing positions are on that, the nursing positions that we have currently?
Yes, they are.
Okay, wonderful. Any questions from anyone?
No?
Okay. And next is the reopening of the state and reopening then of Brockton, plans for reopening of Brockton. Any updates on that, please?
Yes, the mayor, in consultation with the Board of Health, has asked how we should proceed, and we took a slower pace. That is why, as of today, we still have some kind of mandate over mask wearing inside the city buildings, so that we could help to enforce some leverage, because we still have people in the city who are not vaccinated and we don't know who they are. And even prior to reopening, and the governor asking that people can relax the mask a little bit, there were already residents who were not too keen about wearing the mask. So in order to make sure that we don't go too fast, so the mayor has kept in place some restriction, which he planned on relaxing a little bit more by the 18th of this month.
Any questions from anyone on the board or issues?
No?
No,
I see no issues. Agree with the plan, so.
ready to get back to
And then
normal.
Absolutely. Amen
Ready to get
that.
back to normal.
Next item, the dashboard for the city. So our statistics, we're currently in the yellow, but coming down.
Yes, we are in the yellow. We're breathing a little bit better. Today we have 59 active cases of COVID in the city. The percentage rate is below 3% in the population. We are at 434 deaths. We haven't had a death for the past 10 days or so. And so the cumulative cases for COVID is 14,123. So that's where we at. And the prediction is that we may get into the green in a few days, which is a good feeling. So we hope that the statistics will, the science will support the emotion.
Yeah, of the 14,000, what percent of the city population then were infected? I mean, do you know that? I'm asking a number probably that I should be able to calculate myself, but.
I don't have that yet at my fingertip, but
Okay.
when we look at 14,000, that's about close to 1/6 of the population.
So 1 in 6 residents of the city
Yes.
are affected. Wow. Okay. All right. So, any questions from anyone on the dashboard or the numbers?
Nope.
No?
Okay,
Do we have access to copies of them?
Yes, I have a copy of that the state share with us, and we get it from Maven also, the state system of epidemiological data.
It would be nice to have each one of us have a copy of that.
Yeah. Does the state also keep any data on the percent of residents in the city that are vaccinated?
Yes, I have a copy of that. I can probably send that to you if you want. I could send that after the meeting.
Yeah, it would be nice to have that information.
Yes, okay.
You know, just because people know who we are, be able to have that information and say, yeah, this is what we talked about this time. Especially as we move towards school opening in more ways in the fall. I happen to live with two teachers that are always asking, what does the real data tell us?
Right.
Okay.
And I think the last item on the agenda is the health promotion and public health education and how things are going in that area for the city.
Well, I'm hoping that at some point this summer, I will be able to take some resources or move with the nurses into a broader direction rather than just focusing on COVID and vaccination and contact tracing. So that way we would be able to look at a little bit more on the wellness of the city. Because as I came in, I could not do more than just other than focus on COVID. But I feel that we are moving in the direction that will allow us to be able to do much more beyond COVID. So I'm going to be working and watching exactly how to move, because now we have 3 nurses, we can do much more if we're not focusing entirely on COVID. So probably before the summer end, I'll probably come up with a better understanding how to move in what direction.
I miss the days where we could just talk about chickens and things like that.
I gotta tell you, I heard a rooster down the street the other day.
Yeah.
I heard roosters.
Actually, on that note, if I may just mention that there was a request that came in from someone. It seemed that there is someone who is interested in offering acupuncture at the annual farmers market around City Hall. So it wasn't. I did not include it in the agenda because when I put the agenda together, this was not in my hand. They didn't give it to me yet. So I know this is something that I don't think we've had it in the past, but that doesn't mean we cannot have it. But it's acupuncture. Someone is looking to offer that service at the market.
I believe some of that falls under the state rules for, I don't ever remember dealing with acupuncture licenses.
No, yeah, those are licenses that are all a part of the state process.
It's a state process, so they really have to go to the state for that. And yeah, so where they operate and how they operate is more directed by the state than. But it's actually considered it falls under sort of a medical procedure. So
health. Yeah, it's the same process, the same department as getting my nurse's license, getting Dr. Brophy's doctor's, like all those things.
Right.
Same place.
Yeah. So it really doesn't come to the Board of Health. There's an establishment performing a medical procedure at a certain area, and that would fall under. Their licensing and their clinical their clinical privileges to be able to do that, and where they do it, which we all have to report to our various boards where we do our clinical practices. So, and they're most certified. They are certified. So it doesn't come to the Board of Health. It's not an issue that they should come to us for. They really do need to approach the state and the board about that.
Same as tattoos and massage.
Yes. Yes. So any other items on the agenda? Any miscellaneous items? The only thing that I would point out, Dr. Monsoor, you brought up a very important point at the end, that we are transitioning out of the pandemic and trying to get back to normal functioning of the board and addressing many of the other health issues that are related to the city. But I do want to point out that, your staff and yourself have done an extraordinary job. I know it's been nights and weekends and an extraordinary effort put forth by a very small staff there. to do a tremendous job in getting, dealing with both the tracking, working with the state on the cases, the tracking, as well as establishing these vaccination clinics and all the logistics around it, and the success that you've been able to do in getting our citizens of the city vaccinated. So just a huge thanks, I think, from the board, who recognizes the amount of work and time and effort that you put into this. So any other members of the board, any other comments or issues?
Just want to echo that. Thank you for all you're doing.
Yep.
You know, I really appreciate your good work.
Thank you so much for your words, your kind words, and I will share that with the department staff. Thank you.
Please do. So please do. All right.
Thank you.
All right. Any other issues?
All
Okay,
set.
Nope.
All right, so our next board meeting will be Thursday, July 1st. Well, July, summer is coming. Summer with the light of hope.
Yes.
Maybe having a meeting in person someday.
Actually, I'm sorry. Yes, there is the point that was communicated to us by the law department that after June 15, meetings may resume in person.
Ah,
Yeah.
Fine with me.
okay. Wonderful. All right.
So July, we would meet in person?
Well, I mean, you may entertain that. I think there is a provision also where the meeting could be a hybrid.
Okay.
If people feel that it's conducive.
Okay. All right. So we'll, as we approach that time, I don't know, Dr. Andre, how your position is, but right now there's a little bit of the medical centers are bulging at the seams post-COVID with non-COVID related medical stuff. So, availability, or my availability may be limited in getting down to Brockton by time for the meeting. But we can we can consider potentially a hybrid or in-person meeting as July approaches. So
Great.
great.
It's never the easiest.
Yeah, all right. So with that, motion to adjourn?
Motion.
Seconded.
All in favor?
Aye.
Aye. All right. Thank you, everyone. Board meeting is open, and hope to see you soon. And stay safe.
Take
Take
care.
care.
Thank you
Bye now.
so
Take care,
much. Stay safe.
All right. Bye-bye.
Bye-bye.
Bye-bye.